You may have noticed that dialysis is becoming more common for a growing number of patients. Let's review some basic lab tests and strategies to assess and feed the kidneys prior to end-stage disease. Let's start with a simple urine test, specific gravity. If the result is less than 1.020, the kidneys are not concentrating or filtering properly. Have patients drink 8 glasses of pure water daily and retest in 30 days to see if the result is still below 1.020. Less than 1.020 means the kidneys have lost approximately 20% of their function. We're not measuring disease, rather the health or function of the kidneys long before disease is apparent. Next, look at 2 blood tests, creatinine and BUN, which are the most frequent lab tests used to assess kidney status. Unfortunately, by the time results are outside lab ranges, we've lost 70 to 80% of function, and we're now assessing disease. Another test based on creatinine, the age and sex of the patient, is called glomerular filtration rate, or GFR. When levels are under 60, consider preventative therapies. See the attached link for more expanded discussion of lab ranges and tests. One of the things I love about going to seminars in person is the opportunity to hear and share success stories with participants. At a seminar on blood chemistry, a physician at the seminar reported dramatic results with 12 of his dialysis patients using the protocol I'm about to share. When someone is on dialysis, repeat testing is essential to monitor progress. Eventually, as patients were monitored, it became clear that their kidneys were beginning to filter and concentrate themselves to the point where they no longer needed the therapy. Please understand, I am not saying we can get all patients off their life-saving devices like dialysis. What I am saying is we should support and feed the body whenever the need for advanced equipment is necessary to augment therapies. And of course, if we can prevent or treat early, perhaps we can avoid using costly and inconvenient procedures whenever possible. Here's the rationale and nutrients that can be used to feed the kidneys and enhance function. First, consider the oxidation that occurs with damaged kidney tissue. All the cells in the body, but especially kidney and heart cells, have more concentrated levels of coenzyme Q10. CoQ works as an antioxidant inside the mitochondria, or energy plant of the cell. CoQzyme 100 Plus from Biotics Research is a pre-emulsified form of coenzyme Q10 and will raise blood levels higher and much faster than dry forms. 1 capsule twice a day provides 200 milligrams of coenzyme Q10 as well as the cofactors needed for the citric acid cycle to work efficiently. Renal Plus at 2 capsules 3 times per day is added to further the antioxidant mixture and to provide botanical agents to help cut through the mucus that often makes nephrons less effective. Cytozyme KD at 2 tablets 3 times per day provides neonatal kidney tissue to spark rebuilding. Neonatal glands from Biotics Research are from animals 1 to 3 days old. It's difficult to build a building without the specific raw materials. A young kidney is at the height of anabolic growth when it's in its early stages of life. So neonatal tissue provides specific raw materials for kidney growth. An earlier study has shown that gram for gram, neonatal tissue is the richest source of DNA and RNA. Next, Argizyme at 2 capsules 3 times per day provides further antioxidant activity by supplying mixed carotenoids, sprouted vegetable cultures, as well as some essential amino acids. Argizyme is a formula rounded out with a healthy blast of organic beet culture and some neonatal liver concentrate and an herb called tillandsia. Also add Gaminol Forte at 2 tablets 3 times per day. This synergistic blend has been effective to increase lean muscle mass in athletes and growth hormone factors in women. Gaminol Forte appears to have an adaptogenic effect on many tissues, as clinical feedback has been favorable on several issues from increasing strength and fat loss to normalizing menstrual cycles. Gaminol Forte contains gamma-rhizanol, which works as a fat-soluble antioxidant, much like vitamin E, protecting cell membranes. As a footnote, I want to remind you that if the chemistry is too acidic, it will be more difficult for a damaged kidney to rebuild and repair. So please encourage your patients to take their diet seriously. We need to give the body what it needs to heal, and an alkaline medium is one of the critical factors needed to reverse many of the degenerative conditions that we're treating As we discussed earlier, we can give targeted nutritional supplements that will feed the body, but if the chemistry is too acidic, the level of oxidation is increased exponentially. Thanks for taking time to be with me today. I look forward to being with you again next Tuesday.